Thank you very much, everyone, and good evening. Thanks for giving me this opportunity tonight to be amongst this business community, the thinkers and the global trendsetters. First of all, I would admit that we doctors and the healthcare professionals are not good businessmen. We don't have the business acumen, and also we are quite poor in our technology, adapting technologies, but we try hard for the sake of students and our own teachers and the trainers. We do keep up to the standards, global standards, and impart the best education in the university level and at the college and hospital level. Rajiv Gandhi University of Health Sciences, which I represent as the Vice Chancellor, is almost about 29 years old now. And to start with, we had about 200 institutions under our belt, and today we have 1,500 educational institutions providing all kinds of healthcare education, right from medical, dental, Ayurveda, homeopathy, pharmacy, allied sciences, nursing, and many other certification courses which prepare the healthcare professionals in this state of Karnataka. And of course, Rajiv Gandhi University could possibly be the largest one in the country and in the globe in terms of number of educational institutions we handle. And our task in the recent past has been very, very interesting and challenging. We are looking at a time when landscape of healthcare is undergoing a very rapid and profound transformation. In this evolving environment, the education of health professionals must not only keep pace, but lead the way in preparing competent, compassionate, and technologically adept caregivers. So let me begin by acknowledging the multifaceted challenges our gap has, and there's a mismatch between education and practice. So traditional curricula are often heavily knowledge oriented, emphasizing memorizing rather than the application of skills. So this disconnect between academic applications and real world clinical practice results in graduates who are not fully prepared for the demands of the patient care. Then modern healthcare is increasingly complex, involving interprofessional collaboration, chronic disease and communicable disease management, and patient-centered care. So medical and nursing education must therefore evolve from multidisciplinary, team-based learning paradigms. And while technology has brought revolutionary tool to medicine, from robotic surgery to telehealth, it has also created a gap in digital literacy among the health professionals. We are very poor, as I put it earlier. Teaching faculty and students alike often struggle to keep up with the new technologies comprising their potential. There is a shortage of skilled and adequately trained faculty. That's a problem that we face, that every probably healthcare facility faces, particularly in specialized disciplines. So this limits our ability to scale high quality education across the institutions. And traditional assessments often fail to evaluate higher order competencies such as critical thinking, ethical decision making, and professional attitudes. The tendency to rely on written examinations persists even when actual practice requires far more complex integrated skills. So we must empower our educators to become facilitators rather than mere transmitters of knowledge. So they must be trained in competency-based pedagogy, digital tools, formative assessments, and mentoring. So our university, Rajiv Gandhi University of Health Sciences, has initiated continuous professional development programs to upskill faculty in these domains. Academic leadership and also means involving students in shaping their learning journey. So a feedback-rich environment, student councils, peer teaching models, and participatory governance all contribute to developing responsible, self-aware future professionals. If leadership is the engine, technology is the accelerator. RGHS is committed to developing a robust digital learning environment through our learning management system, LMS, virtual classrooms, and simulation labs. So we are creating spaces where students can learn anytime, anywhere, and at their own pace. These platforms support personalizing learning pathways that are essential to CBE. So our nursing skills labs to high fidelity stimulators, technology enables students to participate, practice critical procedures and decision making in a safe, controlled environment. Simulation supports experimental learning, a cornerstone of CBE. We are now integrating telemedicine platforms and virtual clinical case discussions to provide exposure to a wide variety of cases, including those from remote regions. This also prepares students for the emerging practice environment where telehealth is becoming standard. We are moving towards e-assessments and digital portfolios that capture longitudinal evidence of competency across domains, clinical encounters, reflective writing, peer feedback, and more. So let me summarize that our call of action is towards embedded CBE, that is competency-based education, as the foundation of all health sciences programs. Invest in leadership at all levels, university, faculty, and student. Harness technology as a powerful enabler, not just a tool. Promote equity, access, and contextual innovation. Create system of continuous assessment and feedback. Foster a culture of lifelong learning and reflection. So the key areas were for us in the assessment system, from paper dispatching, physical paper dispatching, answer script evaluation, or TADA bill processing, exam center surveillance, document verifications, and student records. So all these were problematic for us. The physical transporting of the question papers from place to place. We have 1,500 institutions. As I mentioned, there was risk of leakage, delays, and security reasons, breaches. Then there was manual paper evaluation, which would take a lot of time. We are doctors and health professionals know we give attention to our own practices, and we are engaged all the time. There was high cost of answer script evaluation and risk of script tampering. And then we had to prepare our handbills. Then there was delay in reimbursements and all that, lot of complaints, especially for the examiners who would come from all over the country for the examination. And we had problems with real-time monitoring of the examination halls and the assessments, and there were some malpractices reported. We also have manual verification of each and every documents, which was prone for forgery and other problems. Time consuming was that. And student records, lack of centralized access. So we have overcome all that now with the digitalization in terms of student-centric services, the college-centric services, and also faculty-centric, university-wide digital initiatives like e-offices, then EMS, examination management system, the e-evaluation digitalization, as Raju put it in the earlier talk, in the scanning at the peripheries, web streaming of the examination halls meticulously being done, and e-consortium for digital sources in the programs with HeliNet management. The student can sit anywhere and source all our e-library now. And also we have implemented for the students Sakala services, digitalizing the documents of all the students for verification in terms of migration or degree certificates and corrections of names and addresses. All those things have been addressed. So the biggest thing we achieved in digitalization was our university was the first one, probably one of the first one in the country to be transmitting the question papers online and peripheral scanning. So it was a role model for all the health universities and other universities in the country, being a biggest one in terms of teachers. We have more than 26,000 teachers and almost about 3 lakh students, and almost 20 lakhs to 25 lakhs scripts being evaluated. It was a big challenge, but we have met that challenge. The future could be build an AI-powered ticket-based system for resolving academic and administrative issues, then automate performance reviews based on the student feedback and academic contributions, digitize the marks, internal assessment marks, and uploading with real-time dashboard access to students and departments, and app-based work for the students in terms of examinations and examiners database, administrators to track the schedules and hall tickets and all that. These are all only going to make the system very student friendly, and for the managements of institutions it will be very smoother and easier, and also the examinations and assessments will be very fair, and in terms of the university management it will be very easier for us to monitor and also assess ourselves and grow together. So all these initiatives are being taken up at the Rajiv Gandhi University of Health Sciences, and with a little more push, we could become not just the biggest health university in India, but the most efficient, students friendly, and teachers performance based university in the world. So thank you very much for giving me an opportunity to present ourselves and to say what we exactly have done at Rajiv Gandhi University of Health Sciences in terms of the recent advances, and also what we are looking at for the future. Thank you very much for giving me another.